Hello guys, welcome to Homeo Health Care. Today we are going to discuss on the topic GERD, that is gastroesophageal reflux disease. So before going to see what is this condition, let's understand the basic human anatomy of the human digestive system. So we can understand this disease very well. So first there will be the esophagus, then stomach, which is J shape. After that there will be the small intestine, and the small intestine has three parts. First part is duodenum, then jejunum, then ileum. After that, there will be large intestine, ascending colon, transverse colon, then descending colon. After that, rectum. So, this was about a basic human anatomy for a digestive system. Now, let's see what is this GERD. Normally also in healthy person this condition can be experienced, like the reflux of gastroduodenal content. What is this gastroduodenal content? The food we swallow when goes into the stomach and duodenum, it gets mixed up with the HCl, hydrochloric acid, in the stomach and in the duodenum with the bile. So then it gets termed gastroduodenal content. This comes up in the esophagus, and when it remains there, and there will be the exposure of the esophageal mucosa to this food particle for a prolonged period of time, then it is termed as gastroesophageal reflux disease. What is the pathophysiology behind this condition? First, there can be abnormality in the lower esophageal sphincter. Then there can be a hiatus hernia, delayed clearance of the esophagus, gastric content, intra-abdominal pressure, dietary intake, etc. So, first we will see about the lower esophageal sphincter. Normally, when the food, the bolus, enters into the stomach via esophagus, after that, for further digestion process, this lower esophageal sphincter gets closed, and there will be further digestion process in the stomach. During this process, there will be the increase in the intra-abdominal pressure. Now, if this lower esophageal sphincter, this tone which it is having, if it get loose, so due to rise in this intra-abdominal pressure for the digestion, this leads to get food exposed into the esophagus, and then esophageal mucosa gets exposed to that food particle. This can be one of the pathophysiology. Or in the hiatus hernia, this hiatus hernia causes and makes a pressure gradient between the abdominal cavity and thoracic cavity, due to which this reflux can be seen. Then another one is delayed clearance of the esophagus. If the food particle remains in the more time in the esophagus, then this esophageal mucosa gets exposed for a prolonged period and this reflux can occur. It can be seen in that patient. After that, gastric content, our stomach, in our stomach, there is a secretion of hydrochloric acid, also known as HCl, which is helpful for the digestion of food. And this HCl is the most irritant substance for the esophagus, and there will be the irritations in the esophagus due to this gastric acid. Then, what about this intra-abdominal pressure? When the intra-abdominal pressure gets increased, then this reflux can occur. So, which are the conditions in which this reflux or this intra-abdominal pressure increases, which leads to the reflux? Obesity, pregnancy. Yes, if a person is obese, then that person may suffer from this GERD. Or in a pregnant lady, this condition can be seen. After that, what dietary intake leads to this GERD? Consumption of excess alcohol, fats, consumption of chocolate can lead to these conditions. So, after this pathophysiology, these conditions may occur. But what clinical features we are going to see due to this pathophysiology in this condition? There will be regurgitation of food. Food will get regurgitated. There will be heartburn, means रेट्रोस्टर्नल बर्निंग, सीने में जलन होना. Also, it gets aggravated by bending or lying down. So, aggravation by bending, aggravation by lying down of this regurgitation, heartburns, can be the aggravating modalities for the gastroesophageal reflux disease. A typical chest pain can be also seen. There may be dysphagia, that means difficulty in swallowing, difficulty in deglutination process for that person. So, such clinical features can be seen in the gastroesophageal reflux disease. Patient will say, and there will be also water brush, मुंह में पानी आना. अब ये कड़वा भी हो सकता है. It can be bitter, it can be sour. Then what complications patient may suffer if this condition remains untreated? There will be esophagitis. That means the inflammation of esophagus. The word itis means inflammatory conditions. So, the cardinal signs of inflammations will appear like rubor, Keller, Dolor, etc. Then, Barrett esophagus. This Barrett esophagus is a pre-malignant condition. That means pre-cancerous stage, a stage before a cancer. These complications can be seen if the GERD remains untreated. So, what about now its treatment part? In homeopathy, after taking a case, going through that case, what remedy comes up that will suit to the patient, and after a course of treatment, he will get relief from these conditions. जब कोई GERD के कंप्लेंट्स लेके एक पेशेंट आता है, जब उसकी अच्छी सी डिटेल में केस ली जाती है, केस लेने के बाद उस पर वर्कआउट करने के बाद कौन सी दवा ऊपर निकल के आती है जो उसे देने के बाद उसे राहत गिरती है उसके तकलीफों से, और ये सारे जो कॉम्प्लिकेशंस है लाइक मैलिग्नेंसी, कैंसर, इसोफेजाइटिस, ये भी प्रिवेंट हो जाते हैं आफ्टर अ कोर्स ऑफ ट्रीटमेंट। और जब उसका ट्रीटमेंट का कोर्स कंप्लीट होता है उसके बाद में उसे वो तकलीफ उतने इंटेंसिटी में नहीं रहती है जितने में उसको पहले थी। एखादा व्यक्ती जेव्हा GERDचे कंप्लेंट्स घेऊन येतात त्याची डिटेल केस घेतली जाते, केस घेतल्यानंतर केसवर वर्कआउट करून कोणतं औषध वर निघून येतं, जे औषध दिल्याने एका कोर्स ऑफ ट्रीटमेंट नंतर त्याला व्यवस्थित आराम पडतो आणि त्याला आधीसारखा त्रास राहत नाही, आणि जे पण त्याचे कॉम्प्लिकेशन्स आहेत GERDचे, जसे इसोफेजाइटिस झालं, बॅरेट इसोफॅगस झाले म्हणजे प्री मॅलिग्नंट कंडिशन, हे पण मग प्रिव्हेंट होऊन जातं. So, as we say, we treat the man in disease, not the only disease in man. आजारात आलेल्या व्यक्तीसाठी औषध देण्यात येतं रादर दॅन फक्त आणि फक्त त्याच्या आजारावरती औषध देण्याऐवजी. So, if you like this video, subscribe to my channel. Thank you.